If your cat has diabetes, this video is for you. My name is Sam, I'm a cat nutritionist and I am the proud owner of a chain of independent pet shops where we help dogs and cats every single day and week with the power of nutrition. Now, let's get straight into it. Diabetes mellitus in cats. What is diabetes and what can you do about it at home? Now, it's a very manageable condition, so I want you to first of all be quite assured that you can manage it properly from home and to calm down and to not make any rash decisions or get anxious about it. That's the first thing. So especially with the right diet, the insulin and monitoring, this is a very manageable condition. So your cat is going to be very happy and healthy if you do things correctly. So in this video, I am going to teach you all you need to know. So pay attention and take notes and rewind and all that good stuff. Now, what is the goal of this whole diabetes thing? Is to improve your cat's quality of life, and with your commitment, you might even achieve remission, which is the end goal if we can. Now let's start by understanding diabetes in cats, and it's very simple and it's very similar to diabetes in dogs and diabetes in people. Now, us humans, for example, can get diabetes when our bodies struggle with insulin, which is a hormone. Cats can too, and it's called diabetes mellitus, which is the most prevalent one, the most common one. Now, insulin is a hormone that helps control sugar levels, which is glucose. So anytime we eat anything, anytime your cat eats anything, that anything or that something gets broken down into glucose, which is the fuel for the body. It's the same for us, the same for dogs, same for cats. Without enough insulin, sugar builds up in your cat's bloodstream, and this is very problematic. And this can happen for two reasons mainly. The cat's pancreas, which is the organ that secretes, that produces insulin, isn't making enough insulin. And the cat's body doesn't respond to insulin properly, which is called insulin resistance. This is more common in older cats or overweight ones. So it's important that if your cat is currently overweight, you should stop everything and put them on a diet and try to slim them down, because that's going to surely improve the quality of their life. So, two reasons. Your cat's pancreas isn't producing enough insulin, and the second one, your cat's body is not responding to insulin properly, insulin resistance. Now, why is remission the goal here? Well, when we say remission in diabetic cats, we mean the diabetes improves so much that the cat no longer needs insulin injections. This makes life a lot easier for you and your cat, and remission increases your cat's lifespan and quality of life. But this can only be achieved if the treatment starts quickly after diagnosis. If we use long-acting insulin, which works throughout the day, if the cat eats a low-carb diet, and I'm going to go over what you need to feed your diabetic cat and why it's so important that you do it correctly. Because if you do not do this correctly, if you do not feed your cat correctly, I'm very sorry to say this, but you aren't going to keep your cat for very long. So pay attention later on in the video. Blood sugar needs to be closely monitored, and the insulin dose needs to be adjusted carefully. So what are the symptoms of diabetes in cats? Sometimes a diabetic cat might show signs like drinking a lot of water, and this is called polydipsia, peeing more often, polyuria, weight loss. Even though your cat is eating well, it's eating plenty, they are experiencing some weight loss. That's something to pay attention to. Weakness in their back legs, making it hard to jump or walk, or maybe they are being a bit more reticent, a bit more cautious whenever they jump or want to move, like little super leopards they are. So if you notice any of these symptoms, a vet can check for diabetes by measuring persistent high blood sugar called hyperglycemia and checking the urine for sugar, which is glucosuria. Now, why does it happen? Why does diabetes happen? Well, in most cats, diabetes is very similar to type 2 diabetes in human. And this happens when the pancreas, which is the organ that does the two functions, the endocrine and the exocrine function, the pancreas produces insulin called beta cells wear out. So it no longer functions properly. And then the body becomes resistant to insulin. Other rarer causes include conditions like a growth hormone issue called acromegaly or pancreatitis, and this is the inflammation of the pancreas. And there are many pancreatitis causes. There's hyperlipoproteinemia, hypercalcemia, bile duct obstruction, it's wear and tear, and we have a separate pancreatitis seminar. So if your cat is struggling with pancreatitis, the inflammation of the pancreas, I highly encourage you to check our other videos. But this is about diabetes. Yes, pancreatitis can be somewhat related, but it isn't the main focus of the video. So if diabetes isn't treated and you don't do it properly, the persistently high blood sugar levels, hyperglycemia, can and will damage the beta cells further, worsening the problem, and this is extremely dangerous. But if we catch it early and we start insulin, this damage can sometimes be reversed. So how can we manage your cat's diabetes at home? Here's the good news, right? With proper care, many cats live well with diabetes for a very long time, right? What are the key steps you need to take? The first one is insulin injections. Your cat is likely to need shots twice daily or whatever your vet prescribes. Modern insulin is getting a lot better and the pens are a lot better, and these new pens make things a lot easier. And please contact your vet for the right amount of insulin, how it's administered, and all that good stuff. Because obviously, different diabetes spectrums, different severity of diabetes will require different insulin responses and different insulin pens. So it's important that everything gets tailored to your cat. So that's the first thing. The second thing, and this is where probably 95% of cat parents get wrong, is the diet. The diet has to be dialed in, and we are going to go over what you need to do step by step. Now, cats, your cat, my friend, and my cat are obligate carnivores. This means that they do not have any dietary requirement for carbohydrates whatsoever. This means that our cats make their blood sugar from protein and fat exclusively in a process called gluconeogenesis, which is the ability to take proteins and fats and convert them into glucose, into energy for the body. So if we have a commercial cat food which is very high in carbohydrates, those carbohydrates are going to cause a massive problem, going to cause a huge problem to our diabetic cat. So a low carbohydrate, high protein diet is essential, is arguably the most important thing. This reduces the spikes in blood sugar after meals, and lowers the need for insulin. So 95% of you are going to do this incorrectly. So what do I want you to do? I want you to turn the bag of food over and every single treat you give your cat. And we are going to try to distinguish between high glycemic carbohydrates and low glycemic carbohydrates. If you feed your cat kibble, that kibble will inevitably contain some carbohydrates. If you feed your cat a wet food, that wet food will probably contain some carbohydrates, and those carbohydrates need to be low in the glycemic index. What do I mean? Well, high glycemic are quick sugars, and quick sugars, whenever we feed our cat big carb meals, we don't want those big carb meals to be high glycemic, to be quick sugars, as it were. So no rice, no wheat, no barley, no corn, no white potato, for example. We want to go for maybe either sweet potato, and we want to go for maybe even some fruits and some veggies, leafy greens in the kibble or in the wet food. We definitely do not want to see any sugar or sugar derivatives in our cat's food. Definitely no sugar or sugar derivatives, no fructose, nothing like that. That's not good for our cats. In any case, these carbohydrates need to make a very small amount of your cat's diet. Remember that your cat is an obligate carnivore. So if we give our cat a food with a lot of wheat gluten, that excess wheat gluten is going to be extremely hard for our dog's pancreas to be able to convert into glucose, and that's going to further exacerbate the pancreas, and the diabetes is going to go down the pan. So what we want to do is a high meat as possible, and low carbohydrate diet. If you are a raw cat feeder, your raw cat food will be 100% meat, and you do not need to worry too much about big spikes in insulin levels. Aside from that, I want you to find sources of easily digestible protein. So chicken or turkey tend to be my preferred ones. We don't want to give our cat something that's too hard to digest. If you have a dog or a cat with or a person even with diabetes, red beef, for example, beef spikes insulin levels in the short term as much as bread, for example. So we do not want to give our cat something that's too hard to digest. Easily digestible protein, think chicken, think turkey, maybe think some fish, and that would be absolutely wonderful. But I don't want you to feed your dog any rice, any wheat, any barley, any corn. I don't want you to feed your cat anything daft like that. Furthermore, if you go to the vet, I'm very, very sorry to say this, but any prescription vet diets are absolutely not the solution whenever it comes to diabetes. So diabetes is a disease that is treated with a low carb diet. Veterinary prescription diets are very high in carbs, are very high in high glycemic carbohydrates. Anyone who knows anything about nutrition, about blood glucose levels, about hyperglycemia, and about all these things needs to understand and understands that those foods aren't very good. I mean, if you are diabetic yourself, you wouldn't go to McDonald's and get those quick sugars. You wouldn't eat processed foods which are high in sugar, high in refined carbs, high in dietary fat. You wouldn't. You would feed yourself a high meat, moderate fat, and low carbohydrate, minimally processed food, and that would be the best for your diabetes. The same thing is going to be true for your cat. So I cannot stress this enough. Low carbohydrates, low glycemic carbohydrates, try to find a food that is extremely low in carbohydrates because, as we said, our cat is an obligate carnivore. So yes, no wheat, no barley, that kind of thing. Now, if you want to get our cat diabetes guide, I will leave the link down in the description for you, and you can download it. It'll absolutely help you manage the cat's diabetes from home, what you need to do, what you don't need to do, how to do this, how to do that. Extremely useful guide, and yeah, very happy to help. Now, how do you monitor your cat's progress? Well, you need to keep track of your cat's blood sugar levels, and many owners use a small glucose monitor if you have one, or you can check your cat's urine sugar levels, and this is something that you can get, again, advice from your vet on how to do it. There are support groups, you can comment below and I'll let you know how to do it, but in order for you to get to grips with this condition, you need to be consistent. You need to be very consistent. The meals and the amount of food you feed your cat should preferably be the same. So, same amount of foods at the same times every day to avoid sugar spikes. Short sugar spikes, which is what we don't want to do. We are going to avoid high carb diets. There's something called mouse size meals for our cats. Anytime I feed my cat, I give him like a little mouse size meal, and I know that's a meal, So high carb diets, and they can disrupt blood sugar control. We don't want that. Wet food sometimes is often preferred because it's usually lower in carbs and more palatable. So if you feed your cat kibble, that's fine. But if you can give your cat a bit more wet food, without sugar, without wheat, without rice, these things, a lot better. It's going to flush the kidneys. It's going to be beneficial for your cat's pancreas, and is going to be overall more palatable and easier to digest. Chicken or turkey, again, they would be preferred. Now, if you do achieve remission and you manage and do this properly, it's most likely if you catch it early. Depending on the cat, a lot of them achieve remission, but even after remission, most cats still have some trouble regulating blood sugar levels and can relapse if their diet or weight isn't managed. I cannot stress this enough. If your cat is overweight, a reduction in adipose tissue, aka fat, aka put your cat on a diet, will improve the levels of cholesterol. The diabetes markers will improve. Everything will improve health-wise if you put your cat on a diet. Having a cat being slim is arguably the most important thing. Once again, one of the most important things whenever it comes to diabetes. So yeah. When it comes to you managing a diabetic cat, can be challenging, can be overwhelming, can be a bit of isolation. You might feel in isolation, but your vet can help you tailor a treatment plan that suits your lifestyle. If your vet isn't being very helpful, you can book a consultation with us and we'll be able to help. So for example, if intensive insulin therapy isn't an option for you, simpler methods to reduce the symptoms and improve your cat's comfort can still be effective, but that would be on a one-to-one basis. We don't know until we know the full picture for your cat. Now, let's simplify all this, right? What's diabetes? The diabetes in cats happens when their body can't make enough insulin or can't use it properly. Insulin, remember, is a hormone that helps manage blood sugar levels, glucose. Without enough insulin, sugar builds up in the blood, leading to health issues. What are the signs of diabetes? Your cat is drinking more water than usual, is peeing more often, is losing weight, is feeling weak or tired. Why is remission important? Remission means the cat doesn't need insulin anymore, but their blood sugar is still controlled. This makes life a lot easier for the cat and you, and help your cat live longer. So, we are going to, if possible, start insulin early. Use long-acting insulin prescribed by your vet. Feed a low-carb diet. Remember, no wheat, no barley, no corn. I know I've said it 1,000 times. It's so important. It's so important. Check every single ingredient in your cat's food. We don't want to see anything vague. We do not want to see any high glycemic carbohydrates. If you have doubts as to what to feed, what not to feed, you can book a consultation. You can download our diabetes guide for cats. And there are so many videos explaining what good carbs are, what bad carbs are, etc., etc. You can get the advice for free on this channel. You can go and look. You have to monitor the cat's blood sugar levels. You need to check them often. I'm not saying be obsessed with it because that is impractical. I am saying often. And then you need to adjust the insulin doses. Work with your vet or with a healthcare professional to find the right amount of insulin. We want to see the highest amount of pound for pound that we can get. We don't want to give our cat too much insulin. We want to give, if possible, a small amount of a dose to make a big change instead of giving the cat a lot of insulin for very little return. Does that make sense? You know, if I have a headache, I want to take the least amount of paracetamol to cope with a headache instead of taking X amounts of paracetamol, maybe more than one, and not having the effect desired. So, you know, I hope you get the gist. Focus on keeping your cat comfortable and healthy by managing the symptoms and any other health issues, aka if their cat is fat, if you have an overweight cat. If you have an overweight cat, the most important thing you need to do is to put them on a diet. Again, there are guides on this channel on how to do it. Key tests, right? High blood sugar, persistent blood glucose. That's a sign that your cat has diabetes. If your cat has too much sugar in their urine, the symptoms, the drinking, the peeing, and weight loss support the diagnosis, but they aren't enough on their own. So just because your cat is peeing more or less or is losing weight, that doesn't necessarily mean your cat has diabetes. It's a matter of testing, and you need to take your cat to the vet. And if you have already taken your cat to the vet, you will know because you will have the sheet and you will have the information. Sometimes, and this is something less talked about, stress can temporarily raise blood sugar levels. So additional tests like monitoring at home or special blood tests may be needed. For example, if you feed your cat beef, a beef-based food, beef is going to elevate blood sugar levels because it raises insulin levels as much as white bread. And this has been corroborated in meta-analyses in human randomized controlled trials. So not every single source of protein is going to be low glycemic. Now, because you feed your cat beef, that doesn't mean they're going to forever keep the insulin levels elevated. It's just a short-term thing, but we don't want to, again, exacerbate our cat's pancreas. So to manage diabetes in a nutshell, diet, low carbohydrate food. It's the 7th time I say it. It couldn't be more important. That will help control blood sugar levels and reduce the insulin needs. Weight control. Overweight cats are more likely to stay diabetic. Same with people. A healthy weight loss improves their chances of remission. Insulin therapy. Long-lasting insulin works best, and regular monitoring will help you adjust the doses. Use a glucose meter or watch for signs like thirst or urination to manage blood sugar levels. And some of the tips for you: feed meals at the same time, the same quantities, ideally, with insulin injections to go with it. Avoid high carb meals. Remember, choose low carb or no carb options. Remember the gluconeogenesis, the ability for your cat to get everything they need from protein and fat. Well, that's what I mean. And then be prepared for inevitable emergencies like hypoglycemia, which is low blood sugar. You can keep at a push some honey or glucose syrup on hand, and you can literally rub your cat's gums if needed. But again, talk to your vet, talk to someone who knows the specifics of your cat, and they can surely help with all these tips. Or if you want to book a consultation with us, you can do so. Diabetes doesn't have to be something terminal. It can be managed. But if you don't manage it correctly, if you don't do it correctly, you aren't going to keep your cat for a very long time. Let me just put it that way. This is one of those things that cat owners don't really get to grips with. They don't understand nutrition. They don't understand how organs work. They don't understand insulin. They don't understand high glycemic carbohydrates, low glycemic carbohydrates, blood glucose levels, etc., etc. And they end up not keeping their cats for a very long time, which is not what I want. What I want is for you and your cat to be happy. Please like, subscribe, and I'll see you in the next one.